Okay, so I was in Mumbai for a council meeting, and fortunately I got to meet Dr. P.K. Jain, who you all know is the founder president of FCCCM and currently is the chairperson of Critical Care Education Foundation. Namaste, sir. So we were having a discussion regarding some changes in the FCCCM exam. So those who don't know, FCCCM exam, Fellow of College of Critical Care Medicine, is an exam which is run by the CCEF for almost 22 years right now. And earlier it used to be part 1 and part 2, 1 year part 1 and second year part 2. And 2-3 years back, the terminology changes to part 1 was PCCCM, and which is a primary certificate examination, and the part 2 we used to call as FCCCM. But now, sir, we are this course is getting some changes, and now PCCCM will continue as a separate entity, and FCCCM as a whole will be 2-year program. So I just wanted to know the thought process behind it and what are the changes, eligibility regarding these courses. So, sir, thank you for giving your valuable time. So just wanted to know that first of all, what is this FCCCM exam, and then we will go to its why the duration change happened.
FCCCM is the Fellowship of the College of Critical Care Medicine. It's our flagship course, and it really transforms people from just the knowledge that they've had or experience that they've had training in the ICU for a few years. It really transformed them into an intensivist. They know how to think, they know how to act. So they become not just nationally certified, but they become professionally respected players. And India needs this. So that is why. And the reason why we shifted from 1 year to 2 years is because over the last 30-40 years that I've been practicing critical care, so much knowledge has come in, so much technology has come in, so much. So it's difficult to cover that in 1 year for someone who has not done post-graduation.
So, but sir, means this 2 year will be when somebody who is enrolling for FCCCM initially will has to cover part 1 and part 2, or it will be a starting point enrollment will be 2 years. It will be for 2 years.
It will be for 2 years.
Okay.
For everyone. See, it's a very different course. It's a very practical course. It makes you think, and not just by heart treatments. It makes you aware of it. So you have to go through from basics to advanced. And in the first 1 year, there are total 25 modules to learn. You've got to learn critical care nephrology, critical care cardiology, critical care endocrinology. So all these things you need to learn. We do them in modules. So there are total 25 modules, of which 12 you do in the first year, and the remaining 13 you do in the second year. And what we do is, after every 3 months, we have a theory exam which is online, which covers the topics that are there in the cover first quarter. Then the second quarter topics are covered. So you actually go into more depths, and it's a very structured course. So candidates are guided and mentored and handheld, so that their knowledge improves, and the second year is where they actually feel like an intensivist. Their decision making, practical, a lot of bedside. They learn more complicated topics like hemodynamic, advanced hemodynamic monitoring, medical statistics, antibiotic selection, and so many other things. How to really write records is taught to them. How to approach a patient at the bedside, how to write reports is very, very important, because most people do a very shabby job out of it. So how do you write a report, and how do you use that to plan your future management, which we call the e-case approach? Everything is taught to them.
No, sir, my question is, just because we took this question earlier. So over a period of 2 years, so we have 24 months. So this has spread out. So every 3 months there will be an online exam, or there is a change in it?
Theory exam, written exam will be there, MCQs every 3 months.
So it
for
will
the
be
first 1 year.
For first 1 year. It will not be in the second year.
No. Second year there will be a final exit exam. Theory.
So means a candidate who is getting enrolled will give 4 exams. Theory means MCQ modules exam in the first year.
Yes.
Second year, there will be no online exam. It will be only exit exam at the end of the second year.
Yes, and that is because Dr. Ankur is it's very important to have a sound theoretical knowledge of the various systems, diseases you will encounter to make intelligent decisions. And so we try to cover that in the first 1 year so that they know everything that they need to know, the theory behind it. And then part 2 concentrates a lot more on the practical application.
So regarding the practical, so this is about the theory exam. So what about the practical exams, or how they are taken?
Well, the practical exams are evaluated. There are various components. One, you have the logbook, which represents the work that they've done throughout the 2 years. Again, it's very structured way. It's not just documenting what you have seen, but you actually take an ABG and interpret it in particular steps, X-ray approach, ECG. So all that is one part of it. Second is that you have e-cases, which have replaced the bedside cases which we used to have for 2 reasons. One, we've started having people from other countries come here who could not examine patients, and getting so many cases was a problem. And e-cases allows us to evaluate in a short e-case the depth of knowledge, and in a long e-case the breadth of knowledge. So you cover many systems and you evaluate.
So they're very long cases, short.
It's a very objective assessment there. And then you have OSCEs, which is a very interesting part, objective structured clinical examination. It has a slightly different meaning. If you look on the internet and you see the OSCEs in Europe or in other countries, they are slightly different. Here, it's closer to what Indians understand as spots. So on a table, you'll have 4 ABGs, or you may have 4 ECGs or 4 X-rays, 4 CT scans, 4 equipments and drugs. And you have a limited time in which to answer them. Usually 2.5 minutes in which you have to answer 4 or 5 questions.
Okay. So this is regarding the exam pattern. We have theory online modules.
Sorry, before you forget, I also forgot, communication is a very important part, which is tested in this exam, because you may do excellent work, but if you cannot communicate with the relatives, if you cannot communicate with your management, if you cannot communicate properly with your colleagues, then your effectiveness reduces.
Okay, so the exam part is 4 online tests every 3 months in first year, followed by the exit exam, which covers whole syllabus at the end of the second year.
Yes.
This practical exam will occur at the end of the second year only,
yes.
OSCE and these e-cases, yes. And we have a logbook sort of thing.
And there are a lot of practice sessions in between,
okay.
But the evaluation is at the end.
So sir, before I go deep into all these things, just wanted to know that when does this course tenure starts? When from it's in the mid of the year, or when this starts?
We started 23 years back with a course which started in January and the exams were in December. But then in between we realized that a lot of candidates who give the NEET exam in the middle of the year and they don't clear it, they opt for training in critical care. So on a lot of recommendation and requests, we shifted to a mid-year, so July-August system. But now we are realizing that it becomes very difficult to remember the mid-year and 2-year system. So we want to migrate back to a term that starts in January and ends in December. But this year, currently, we will have to go through a transit period to move without affecting the candidate.
So when does this 2026 course will start? And
we're looking at starting it as soon as possible, so that closer to January than July, August. So somewhere in between it would be there. Right now we're looking at April.
Okay. So for this year?
For this year.
Okay.
And from next year it will be January.
January. So January to 2 years, and then in December we will have the exam. So who all can, very important question, and we need a clarity on this, sir, who all are eligible to give the exam? Part one of my question. And second part, do they need to leave their place and enroll somewhere in an institute to give this exam? So,
I think that's a very, very interesting question. Who can register? I think both MBBS doctors with 1 year of ICU experience and MD doctors can apply for this 2-year course.
graduate and postgraduate.
Graduate and postgraduate.
Okay.
There is a view that some people hold in the country that it should be only postgraduates, but the reality is that India has just 4,000 to 5,000 intensivists, where we need around 50,000 intensivists, and doctors trained post MD tend to go to the cities rather than to the districts and low resource areas. So we have, if we think of the country as a whole, it's very important to have MBBS and MD doctors both. And what is the difference between an MBBS doctor and MD doctors? One day before the exam, an MD doctor is MBBS with 3 years experience, and one day after the exam he becomes MD. So 3 days really doesn't change him. MBBS doctor with good training is a very useful resource.
So this is means graduate with 1 year of ICU experience and postgraduates, though it is a desirable some ICU experience, but they can apply.
It's not mandatory, because during this course they will work in the ICU for 2 years.
During the
and
post-graduation.
they have the good medicine knowledge.
Okay.
So and we stress a lot on the practical training.
So any postgraduate can give, or there are different specialities only they can give?
Yeah, it's the relevant specialities like general medicine, anesthesia, pulmonary medicine or chest medicine or respiratory medicine, emergency medicine, they can. But if you say MD physiology or MD PSM or MD pharmacology, they really do not have the general medicine knowledge that is required, so they would be equivalent to an MBBS or diploma.
Graduates, and they need a 1 year ICU
They
experience.
need 1 year ICU experience.
Now my second question, sir, very, very important. Suppose somebody who is a graduate or postgraduate and working in whichever setup they are working in the intensive care unit, so they need to leave their place to pursue this exam, or what is the structure regarding this?
Yeah, some people had that system, but I speak for the College of Critical Care Medicine. We believe that it's not a practical solution. You have a family. Your schools children are going to a particular school, your parents are there. It is not possible to leave and go for 1 to 2 years to major cities there, and it's really not required, because it's in India, it's not lack of equipment that is an issue. Most ICUs will have ventilators, monitors, infusion pumps, syringe pumps. They will be familiar with vasopressors, they will have defibrillators, most of the things that you really require. And so you can continue to work, and I think you should continue to work in the environment. We have to look at developing critical care across India and not just tier 1 cities. So you definitely continue there. If you have a local teacher, that's very good, because now we have trained hundreds of fellows over the last 23 years. There may be a fellow there who could be your local teacher, your head of department. So to be a teacher, of course, if you have done your FCCCM or you've done advanced fellowship, you become a teacher immediately because you have gone through the system. But if someone has done medicine, MD medicine or anesthesia, and has 5 years of ICU experience, they can also become a teacher.
So they need to apply to CCEF?
They need to apply. That's the ideal situation, that they need to apply. But what the college does is it also supplements the local teaching through various mechanisms. It has weekly classes, Zoom classes, and it has a fantastic knowledge hub site, where otherwise there are something like 25 textbooks in critical care, and a candidate some topics are covered well in one book, some in the other book. You cannot read all the textbooks. And if I were to read a topic, say epilepsy, and I were to go through 25 books, then, or even 2-3 books, it would take me about a week to do that. Whereas what Knowledge Hub is, all the knowledge from the 25 books is condensed into one single chapter.
Okay.
Then there is also a recent advance on the same topic. So recent advances in epilepsy, for example, will have the last 4 years of material from the journals and updates. So you can update, and this is important for the second year part of it. Then you can assess your knowledge by multiple choice questions on the site, which automatically evaluates how you're doing. If you score less than 70% in the MCQs in Knowledge Hub, that means go back and read the topic again. And so it's a self-driven, you can do it at night when you come back from duty, you can do it on a weekend, etc. So Knowledge Hub is very powerful. You have the weekly classes. You have intermittently self-assessments which go to you. So self-assessments in ABG, you have sent a question set, and then you answer them, and then on a Zoom meeting, the correct answers are discussed with everyone. So the college supplements a lot of teaching which is done locally.
No, so my question again means a little bit needs a little bit clarity. You have told that other than the assessments which are going in theory exams, the college also provides a knowledge hub platform where it's extra chargeable or it is included?
Well, for it is chargeable site. A lot of energy and effort have gone into it and to keep it updated. But to our candidates who register for the exam, it's included in the fee. So the fee is very small, and this takes care of it.
So we provide them a reading material sort of thing, which covers all the systems where they can read. Now, my question again, sir, a little bit of more clarity. Suppose a person is working in the ICU and he or she doesn't have a teacher there working in the ICU. First thing, they need to be mandatory working in the ICU during this fellowship.
Yes, it's very important. Whichever course you do, the PCCCM or the FCCCM or advanced fellowship, you have to be working in the ICU at that time.
Okay, so now they don't want to leave their institute and they don't have a local teacher also there. So how they will make sure they can enroll and they will be trained during this
That's
year?
true. We have given a deep thought to this, and we have to understand the ground reality. This situation is not uncommon because we don't have enough teachers across the country. We have about 20% of our requirement or even less than that. So what the college has decided is, over years, teachership will develop, but right now the candidate can say that they don't have a local teacher and request the college to provide a mentor who will supervise their training from the college faculty. Now, the way this works is the mentor doesn't replace a local teacher. So, though they don't have a local teacher, they will have someone who will supervise that they actually did the procedure, they actually saw the case. This may be a person who's heading the ICU. It may be your medical director. It may be any senior colleague. They just need to say that you have attended, you actually did it, and they sign it. The mentor who is sitting maybe in another city or near another town would then interact with you and then countersign it, and that's the best way we can ensure it. It's a practical solution to a difficult ground reality.
So what my understanding as of now is, a person, if crosses the eligibility criteria, eligible, enroll for a course, reads the Knowledge Hub, give the exam on the set schedule in the first year, then the exit exam at the end of the second year, including the practicals and the theory. So they will not be in touch of the college physically, or there will be some contact sessions for them along with the college somewhere in these 2 years?
Oh, that's a very important question. Yes, it's very, very important. What we have contact periods which are about 4 days duration. We have an orientation at the beginning, and the word orientation tends to be misleading because people feel we'll just tell them how the course is run, etc. But it's actually teaching critical care very intensely and to great depths over these 4 years. So over these 4 days, that they learn, and that is really very, very, very important because they know the depths that they must go to. For example, people come with this misnotion that if you have an ABG and you just pick up metabolic acidosis, you've done whatever is required. In fact, that is so grossly inadequate. You need to find out what type, what is the cause, how to do it, to what depths you must go. That is very important. So that is all taught in the first 4 days. Then the whole year they work in their own institute. They're weekly in touch with the college. They have the local teacher supervising.
How they will be weekly in touch with the college, sir?
Through the Zoom classes.
So we have weekly
Yes,
classes also.
we have Zoom classes, and we have periodical exercises that they need to do. And then in the second year, because it's an advanced second year, they have an orientation with advanced topics.
So at the start of the second year.
year. And then before the exam, usually 1 month before the exam, they have a intense crash revision course. And that's 4 days of practical tips. They've learned the topics. Now they just got to speed up. They need to know if this and this occurs. Usually you must think of this first. That sort of a thing that they are taught. Those are practical tips which come from experience and evidence based. And so these physical contact periods are very, very important. There are no substitute. They have doubts. So if you listen to a lecture, I often wonder and person is sitting in, say, a conference, we have no way of knowing whether they understood it correctly, they didn't understand it, or they understood it wrongly. But if you interact physically, a lot of doubts can be clarified and you know that they've understood it correctly.
Okay. So, sir, all information one can get from any website?
Oh yes. The College of Critical Care had a good website, and now we've really made it very in-depth website, which we'll be launching in 2 days. It is AI powered, so you can actually ask it questions. You can ask it when the next course is there, what is the last date, what is the fee, etc. But there are documents there in depth. As for the candidate, there are documents for how to become a teacher. There are documents for how a hospital can get recognized. And remember that it's very prestigious for an intensivist to be recognized as a teacher in critical care, or it's very prestigious for a hospital to be recognized as approved by intense accreditation process and inspection that they are a teaching center in critical care.
So the website is collegeofcriticalcare.org, which will be launching very soon. As of now, it is collegeofcriticalcare.com, but it will be collegeofcriticalcare.org. And the ICUeducation.com is also a part of CCEF, which has a separate registration.
It's a self-assessment module. That's again, thank you for reminding me. You can do a lot of self-assessment and do many courses on ICUeducation.com. So if you want to understand how to examine cases, you can do the e-courses, their e-cases, you can do your medical statistics there, you could do blood gas interpretation, ECG. These are nominally charged, so they're paid courses, but you can also do ask the system, ICU Education, I want to learn x-rays, so give me, I have half an hour, so give me maybe 10 x-rays, or you say I've got 2 hours, give me 20 x-rays, or you can say give me 5 ABGs, 5 ECGs, 2 x-rays, 3 CT scans. So that flexibility is there, and you can then learn.
So these are the 2 websites where you can go and register. Sir, one thing I forgot to ask, suppose a candidate at the end of the 2 year doesn't clears the exam. So he need to again register for the 2 year?
Well, if you have failed the exam, you've been unsuccessful, let's not call it failure, you've been unsuccessful temporarily, you get one chance to appear again next year. You don't have to register, but you have to pay the exam fee there. But if the second attempt also you don't pass, then you need to register again.
Okay. So this was regarding FCCCM exam. So if you have any doubts, you can always go to the website and you can ask in the video. We'll put it in. Now a little bit about PCCCM, which is a primary certificate course in critical care medicine, which is relaunching this year. It was stopped for 2 years, I think.
Yes.
Now it's relaunching. So can you give me a brief about this is a 1 year certificate exam. So why you felt the need of PCCCM to be relaunched, and a little bit about its structure.
Okay. Now, we thought few years back to discontinue PCCCM because it was a primary course, and everyone was concentrating on technology and new knowledge and evidence-based, etc. So FCCCM. But then we realized, looking at data and statistics that's coming out, that 1.4 billion people, 70% in resource restricted environment. In fact, even in major cities, tier 1, tier 2, there are institutes which have resource restrictions. They don't have continuous dialysis facilities. They don't have ECMOs. So they don't have a lot of technology. You don't need every center to have advanced mechanical ventilation there. So, and especially if you look at the remote parts of India where there is very poor access, people have to travel 50, 60 kilometers to get a decent ICU. We need to also work in these areas, and this is ideal for MBBS doctors who stay in that area but have not got exposed. In fact, it's not that there are no ICUs there. They're being managed by people who have no formal training. They have experience, which is very good. That's their strength. But a structured course is transformative. It makes you more confident. It makes you really an intensivist in your heart and in your brain. So you learn how to observe, you learn how to think, not just do every investigation possible to find out if something is wrong. That is expensive, and India cannot afford expensive critical care there. So if the PCCCM was launched in a new avatar, which is in a resource restricted area.
Okay.
Now, what does the resource restricted area, let me tell you, is an ICU which has 1 or 2 ventilators, maybe an NIV, non-invasive ventilator, has bedside monitor, has a defibrillator, has a syringe pump and is using vasopressors and sedatives and neuromuscular blocking drugs, gives thrombolysis, manages poisons. Isn't it a scenario you're familiar with? Now, this does not need a very DM type of a critical care intensivist. MBBS with training is absolutely suited because he lives in that area and he can practice in that area.
Postgraduates also, many of the postgraduates are working in the resource limited setting. So this will help them also?
Yes, absolutely. Now, it's not to say that this is a scaled down course. It's a fairly good course, and I think 90% of anything that you would deal, a PCCCM candidate will be able to handle. It's just the advanced technology. So where I think the FCCCM candidate can work anywhere in the country, anywhere in the world he can work. But a PCCCM is trained basically in 80% of the skills that you need to manage without sophisticated equipment.
So it's a 1-year course, and again my 2-3 questions remain the same, sir. Do they also have to give every 3 months the theory assessment like that?
For PCCCM, no. There's a lot of teaching going on, but they only have an exit exam.
Okay, so exit exam will be theory and that
Theory, OSCEs, communication, and e-cases.
And the contact programs will be again orientation.
Orientation and crash course. So orientation at the beginning of the year, which probably will be along with the FCCCM first year, and the exit exam is 1 month before it's a crash revision, 1 month before the practical exam.
So again, sorry for repeating this question. So in a resource limited setting, suppose it's a village or even in a place where in tier 1 cities also there is an institute which is a resource limited settings, limited amount. So a candidate wants to enroll for that course, PCCCM. So they need to leave their job, or they need to have mandate teacher in their institute, or the college will provide them. How this will go?
They don't need to leave their job. That's one thing very clear. No one needs to leave a job. It's not practical. If everyone came to the cities, they won't get a job. Okay, they need to continue in that way. They need to continue because their family is there, their children are there, their old parents are there. And we hope that when they train and graduate, they will also practice in that area.
Okay.
So we don't want them to change the environment at all. If they have a local teacher or a senior who meets the criteria, excellent. He will train them, supplemented by the college. And if he doesn't have a teacher, we recognize that as a temporary situation, because if we train him, then he will become the teacher for the future doctors in that area. So we are investing in this person who has no teacher right now by supplementing a mentor from the center.
Okay.
And in the hope that as he evolves, he will then pay his dues to the society by becoming a teacher and passing it on.
So, a question related to both the exam FCCCM and PCCCM. Suppose during this 2-year training program, something happens and the candidates after 1 year or 6 months want to change the work hospital or work city, then will he or she be able to do that? Will this affect the enrollment?
That's again a very good question, and it's a reality. Women get married and have to shift, or their husband's job transfer is there and they need to shift. It's a reality, and you can be assured, whatever time you've worked, and we hope it's at least 6 months there, you will get that credit in the next institute. So it will be counted as a continuity that is there, but you must have compelling circumstances, not whims and fancy that every 2-3 months you're changing your institute. That's not valid. And you need to contact the college and explain it to them. And then of course, wherever you're leaving from, you need to get an okay from them. And wherever you're joining, you need to get an okay from them. We want to be very sure that you weren't actually fired because you never attended the ICU, or you were a bad clinician, and therefore you're changing there. We respect the teacher who is there locally, and they should say, yes, it's a genuine reason and we're happy to recommend that they shift.
So if the teacher is happy, that question. Suppose that local supervisor or the mentor or the teacher doesn't feel comfortable that my candidate or this candidate per se is not up to the mark, not about this shifting thing, this can happen, but not studying or not up to the mark at this particular stage. So will they be allowed again to appear for the exam, or there is a check in it?
That is a valid question. If the person who's supervising you doesn't have faith in you, there's a good reason why he doesn't have a faith in you. Then the college would review it with an honesty. There'll be not just one person, and the academic council will review it with the college president, and they will try to see, and they will listen to you. They will give you a chance to explain yourself. But if they feel that no, the problem is with you, then they can stop you from appearing for the exam.
So I would flip the question. Suppose the candidate feels that the teacher under which they enrolled locally is not giving them proper time to train, or maybe not because of the ill intention, but because of the sheer busyness or something like that, not able to give time to teach or train the candidate. In that case, can the student approach the college?
Of course. You see, there are 2 forms that are mandatory for filling. One by the teacher who evaluates the student periodically, and also the student who evaluates the teacher. And these are confidential. That means really neither the teacher sees it and it goes straight to the college. These are predefined, well thought of forms that are there, and if we get a report like this, it is an alarm matter. It's reviewed. We try to find out from others whether this person is like this, and we may tell the teacher that, look, based on feedback that we have received, you need to spend more time, and give them a chance. We always believe in giving a chance. We're not saying, oh, you're out, you're fired. No, we believe in giving a chance. But if it's a recurrent pattern, then that person is discontinued from the faculty.
Okay, sir. So if you people still have, or those listening still have any doubts regarding or questions regarding things, you always can go to collegeofcriticalcare.org
and also .com.
Also .com, both working, and icueducation.com, because your registration part will happen on icueducation.com. Yes. One more thing, sir. I think we need to remind that anybody who wants to apply for the fellowship has to become a member of the college, CCEF.
Oh yes.
So it's a very nominal amount, and you can become a member, life member, by that, and that membership number is required to get enrolled for this exam. It's a very simple procedure. Before ending this, sir, I want to touch a little bit about AFIC. which was advanced fellowship in intensive care, which was running till this year. But from this year, there are some modifications done in it.
Yes.
So can you, I think which they will be announced in a month or two, but can you give an idea how this advanced fellowship is getting modified by CCF?
Yes. You see, what we included in the advanced fellowship in intensive care, which is a 1-year course, has now been taken into the second year of FCCCM. So all those topics are covered. And there was no point in again repeating that for 1 year. But what we realize is what India needs, and India is evolving very rapidly, is we now have transplant critical care, we have neurocritical care, we have cardiac critical care, we have so many specialities coming up, subspecialties. We thought that the advanced fellowship in intensive care would be a 1-year fellowship in such recognized institute, recognized teacher, where you have already got a critical care certification like the FCCCM or equivalent or EDIC or something like that, and you work there for 1 year. And the best part is there is no exit exam. Once you work for 1 year and your teacher says yes, he's got or she has got adequate exposure, you get the fellowship issued by the college jointly with the hospital and maybe other authoritative bodies.
So basically it's a European or Australian model.
Yes, it's the American European model.
Where
Australian.
you work for 1 year and you complete the fellowship without
Yes.
It's totally assessed by the institute in which you are doing.
Basically, you're already qualified in critical care. You just want experience in a particular subspecialty, and that is at a center which has been inspected and approved. So that's all you need.
Okay, so the details of this advanced fellowship will also be available soon, but as of now, the major structure is FCCCM has become 2 years. PCCCM is launching, and all the details are available on the website. And in case you still have any doubt, you can write either to the college at office@ccef.in, which is the email ID, office@ccef.in, or you can visit the website. Even if you can apply, you can ask in the comments. We will try to review that. Thank you, sir, for sparing your time. And
I just say one last comment, if with your permission, I can say. I would say to you that if you want to be practicing critical care, go ahead and register, whether it is for the PCCCM or the FCCCM. But if you have postgraduate qualification, you have got 5 years of experience, or you've done a fellowship before, then it's very important that you play this role for the country, become a teacher.
Okay.
And that is very, very important. If you need any help becoming a teacher, the college is always there to guide you.
So, because we are ending, so for becoming a teacher, does their institute also has to be authorized by the CCF, or they can independently apply for teachership?
That's a very good question. Ideal situation is the institute applies for recognition and the teacher is recognized. But the ground reality is very often, apart from some outstanding institutes, many institutes are just struggling to survive and make money. So they are not interested in academics. It's not a money generator. It's something that brings you reputation. So if the institute doesn't show interest there, and if we don't recognize the teacher, we're losing a very good teacher. So the teacher can apply independently and give a declaration that we meet with this requirement, we have the number of ventilators, we have the number of beds, we have the number of case mix, etc., which you will see when the hospital criteria. There are different types of hospital recognized. So tier 1, tier 2, tier 3, you can see which one you meet there, and you can be an independent teacher.
Thank you, sir. So share this with your colleagues whom you feel that they are working in critical care. They can become a teacher, or somebody who is in need or searching for certain courses, or they want to get trained in a particular course of in critical care. Maybe this will be helpful to them. And you may find that as compared to all other videos which I post on the channel, I was not that much energetic in asking the questions. So one reason is I was sitting with PK Jain sir. So already my body language it becomes that. And secondly, we were working till 2-3 a.m. in the night, and so it could be a reason for that. But thank you, sir, for your time. And I hope this session would help you clear some doubts regarding the courses and training programs which run by the CCEF. Thank you, and see you soon in the next video.
Yeah,
Thank you.
The secret to success: take the first step. If you want to be successful and you don't take the first step, how will you be successful? So don't hesitate taking the first step.
So
Thank you, Uncle.
With that message, we'll end here. Thank you.